Hello dear friends, today we will talk about contraception, the methods that you can use to prevent unwanted pregnancy. Be sure to watch this episode to the end and we will dispel a few myths about contraception with you. The history of contraception dates back to ancient times. Even in ancient Greece, even in ancient Egypt, there were already the first condoms. They used fish bladders for their manufacture, used snake skin, also used flax, and the first silicone latex condoms. They resembled some scary device with a thick shell. They were reusable and they were sold in special large pouches that people carried with them and used the same condom. Sometimes over the course of several years, progress did not stop there. And of course, in addition to male contraception, there is also female contraception. And the history of female contraception also goes back to ancient Egypt. The first pessaries were blockers, so to speak, cervix caps, to prevent spermatozoa from being attracted through the cervical canal. Already in ancient Egypt, women made pessaries from leaves, clay, and other available materials to insert into the vagina and prevent sperm from entering. In the tales about Kazanov, there are methods of contraception with the squeezing of lemon juice into the vagina after sexual intercourse. But all modern methods of contraception are actually divided into 4 groups. This is barrier contraception, to which we include male condoms and, by the way, female ones, which many of you do not know about. The second is interrupted sexual intercourse, also a form of contraception, and probably the least effective. Because statistically there is a risk that you will have an unwanted pregnancy within a year if you practice interrupted sexual intercourse. Third, it's vasectomy. It's the tying of the sperm-carrying, sperm-ejecting ducts. It's what serves as a conduit through which spermatozoa run from your appendages and emerge outside through the seminal vesicle in the form of ejaculate. And the fourth is such an unexpected one, but also a form of contraception, is the practice of abstinence. That is, you do not bring yourself to ejaculation or do not engage in sex at all, which I think is not very correct. By the way, there is an episode about abstinence on my channel. Be sure to check it out, watch it. All methods of contraceptive drugs that belong to tablet therapy, they unfortunately or fortunately are not used in today's practice because it's very difficult to make the male reproductive system infertile. That is, to make it so that you could not conceive a child and at the same time not cause you significant harm. All the drugs that have been used or created for male contraception to date, they disrupt our endocrine system. That's why today we will only talk about the 4 types that I have considered. Let's start perhaps with the most radical and complex vasectomy. I perform this manipulation for some couples who prefer vasectomy. That is the ligation of the ducts through which the spermatozoa move. To prevent unwanted pregnancy because the wife has contraindications, either they already have 3 or 4 children and they just don't want anymore, or she is of age and pregnancy is already a contraindication due to age. Since the woman is still menstruating, the man, understanding the harm of female oral contraceptives, they are harmful, they cause thrombosis, they have many side effects. The man undergoes a vasectomy as it is one of the most effective methods of contraception and he thinks about the woman. But sometimes boys come who are quite young, in their 20s to 25, and they say, I want a vasectomy. I do not recommend a vasectomy at a young age because, contrary to popular belief, vasectomy is an irreversible process. That is, you can't, having tied them up, then sew these ducts again and everything will be fine with you. Most often, unfortunately, the effectiveness of all these sutures does not exceed.
When they are tied up, they're from excessive pressure, well, naturally, it just stops being produced.
If the seminal ducts are tied, nothing terrible will happen. The man will absolutely not feel this in any way, and no pathological changes in the body will occur after this. This is absolutely normal standard practice in many civilized countries. There are different types of condoms. There are even condoms with spermicidal lubricant. This means that the lubricant will either slow down or kill the spermatozoa. In general, the female vagina itself, it is very aggressively tuned to spermatozoa, and the flora into which the spermatozoa fall, it can already kill a large part of the live spermatozoa in your evacuator. That's why through the citric acid channel to the egg cell to fertilization, the most viable, the healthiest, the most life-capable ones get there. In fact, it's natural selection in its life form. Still, if many will ask, because it's likely, if an unwanted pregnancy occurred, what to do? Of course, it's not very good for your partner to bring it to the point of abortion. There is such a concept as a medical abortion. That is, 2 pills are taken, the first one in 72 hours, the second pill 12 hours after the first one. This allows you to have a medical abortion and not put your partner's life at risk, given that in the later stages you would have to perform a scraping, that is, an abortion. If we briefly talk about contraceptive women, in addition to tablet preparations, there are different types of implants, spirals for example. That is, it is installed inside the uterus, and thanks to this, a woman can have sex for 3 to 5 years without fearing that she will become pregnant. But all this is invasive. There are also its disadvantages, and there is even one study that I came across, and there are different casuistic cases. In one case, a child was born holding a spiral in their hand. Well, most likely, maybe for the beauty of the picture, but indeed, despite the spiral, the child was still born. She carried it out during childbirth along with the baby during labor. The spiral also came out, which he grabbed, and such a funny picture turned out, such a life-affirming one. The baby was born despite the spiral, and he is holding this spiral. That is, it did not prevent him from being born. As I mentioned, the rings are not very comfortable. There are large-sized female contraceptives with a large pocket sinking into the vagina, all this. They are actually even more effective than male contraceptives because they also protect the labia and the outer part of the vulva, which comes into contact with fluids during regular sex. All infections, as you know, are transmitted through blood when in contact with damaged mucous membranes, and also some pathogens are specifically in semen. The point of barrier contraceptives is to create a barrier that neither bacteria, viruses, nor sperm can penetrate. But it's important to remember that condoms, like helmets, help protect but do not give 100% guarantee. Condoms can be of poor quality. Condoms can tear. Therefore, this idea that the condom is 100% protection, you should not think so. The only guaranteed way to avoid pregnancy is through abstinence.
Is it true that ultra-thin versions of condoms actually let things through?
No, I'll explain a simple thing that all condoms do not let liquid through, first of all, and liquid is what these viruses, spermatozoa, live in. They don't move through the air, they move with the liquid, and therefore, since water and liquid molecules cannot penetrate. These ultra-thin condoms, they are safe, but there can be micro tears, micro damages, which we simply do not notice. Naturally, the thinner the condom, the greater the risk that it can tear. Yes, more pleasant sensations. Yes, you want to be in a thinner condom. But remember, statistically, the risks of sperm breaking through such a contraceptive due to physical mechanical trauma are high. All condoms from reputable companies are quality checked before packaging using special devices that inflate them to test for defects. It's not that simple because nothing miraculous happens there. Imagine if a company got sued at the first such case. There are also methods of male contraception when a man experiences a dry orgasm, that is, they squeeze the gap and do not allow the ejaculation process to occur outside. It's not really beneficial if you practice this on a regular basis. This can cause serious disorders, potentially leading to future development of anorgasmia, the inability or difficulty achieving orgasm. There is a method, still premature, and here's what I want to say from myself. Note that most often the tension during interrupted sexual intercourse occurs when couples start having sex for the second time. That is, there was a sexual act, it happened not in a partner, not in a partnership. The partner ejaculated conditionally, washed up, went for a walk, lay down for half an hour or two, and engaged in sex for the second time. Yes, the ejaculation process has ended, yet again not in the partner. But the seminal fluid, the secret of the prostate gland, which was released during sex through the canal, washed out some small parts of the spermatozoa into the vagina and caused an unwanted pregnancy. That's why repeated sexual acts are very dangerous in terms of unwanted pregnancy. That's one thing. If you still want to do this, it's advisable to use protection between the first and second sexual act. That is, drink plenty of water, urinate to clean the canal, and only then have sex for the second time.
I read that during the first sexual act, seminal fluid is released even before orgasm.
The prostate gland secretes a fluid, but not seminal. because seminal fluid is released at the moment of orgasm due to the contraction of the prostate and the expulsion of semen, which together with the prostate secretion come out. And many are afraid that it contains spermatozoa. Mostly it does not contain them, but you should not rely on this. That's why interrupted intercourse is considered the worst method of contraception. The most expensive contraceptive ever released was by a company. It cost $68. We'll add the picture here if we find it, but I'm not sure if we will. But what I can say is that you definitely shouldn't skimp on contraceptives. If you're going to buy contraceptives, only buy from known brands, only good ones, only quality ones. Let's now debunk the main myths that you often encounter on social networks and that have lodged in your head. The first, most popular myth is that it's impossible to get pregnant during your period. That's not true. Sperm can live for up to 5 days after ejaculation. Therefore, if ovulation occurs within these 5 days, your partner can get pregnant. So if you think you can safely have sex monthly, that's not the case. If you're not planning on having children, I recommend you still use barrier contraceptives during these days. Many people think that one type of contraception is enough and the effectiveness does not increase when two types of contraception are combined. In fact, this is not the case. One of the most reliable, safe, and simple methods of contraception is the use of spermicidal lubricant and the use of a barrier contraceptive. Spermicidal lubricant is a lubricant that kills your sperm, and therefore the chances of unwanted pregnancy will be significantly reduced. Some myths suggest that contraceptives cause infertility. Infertility is not caused by any contraceptive that exists on the market today. There is another very important myth that if you are in a monogamous relationship, have an official wife or a husband, then you do not need to use barrier contraception. Unfortunately, a large part of people who come to me for a consultation secretly sleep around, change partners, and catch some sexually transmitted infections. And sometimes, because medical ethics and the necessity to keep medical confidentiality force me, I go to a meeting pretending that it's just a checkup. I have to lie in order not to break up a marriage. Being in a relationship doesn't guarantee protection from infection. Using barrier contraception is still advisable. Because 42% of partners in a marriage don't know that their partner has a sexually transmitted infection. I'll talk in detail about sexually transmitted diseases in the following episodes. I'll discuss their consequences and how to treat them. So subscribe to my channel about men's health, hit the bell, and stay updated with new episodes. Many men believe that contraceptive pills provide a 100% guarantee. That's not the case. No form of contraception provides a 100% guarantee, except perhaps for vasectomy. And they believe that this is the only reason for a woman to use them. In fact, it's not. Many endocrine disorders, hormonal treatments are treated with the help of oral contraceptives, so-called SOCs. Another myth is that all contraceptive methods are equally effective, which is false. The effectiveness of a condom, according to a series of studies, is about 85%. The effectiveness of oral contraceptives ranges from 91 to 99%. Next, I'll talk about how you can use modern methods to test for sexually transmitted infections. To avoid inserting this unpleasant, dirty, and diseased swab into your urinary tract. And the information will be just as accurate. So stay with me, hit the like button, and listen. Standard practice for sexually transmitted infections, checks for sexually transmitted infections, is what we call a swab. They take a slimy swab from the urinary tract. It's very unpleasant, feels like they've shoved a brush up your urinary tract. After which, the first few times when you go to urinate, firstly, it's very unpleasant. Sometimes the pain lasts for hours. Secondly, sometimes they do it so roughly that it even injures the urinary tract. Many men, because of this, blindly start treating themselves with old antibiotics that were once prescribed to them, because they are afraid of this procedure. The most interesting thing is that in reality, if your doctor is competent and on the spot, he will not subject you to this. And you can even do this without the help of a doctor. How is this done? You go to the pharmacy, buy a regular disposable urine cup, and the first portion in the morning. Why is it very important to do the first portion? Because the first portion of urine is a washout from your urinary tract, the second portion of urine will already be urine. Well, after 5 to 7 seconds of urination, it's urine from the bladder, it will already be clean, and the first portion is a washout from the urinary tract. You urinate into this sterile jar, close the jar, take it to any laboratory and ask them to do a polymerase chain reaction for sexually transmitted infections from urine. Alternatively, you can provide a sperm sample, and unlike the ejaculate analysis, where you need to do this within half an hour to 40 minutes, you don't need to rush, breaking your head, to quickly deliver the sperm and submit it for analysis for the same polymerase chain reaction infections. Yes, it is called polymerase chain reaction, and depending on the number that stands after the polymerase chain reaction inscription, it is the number of pathogens that you are testing for. It usually happens there sometimes. Very effective, absolutely the same information as with a swab, but absolutely painless. So either the first portion of urine or the first act of ejaculation. If you have an infection not of the urinary tract, but an infection of the upper urinary pathways, then of course it's better to give a urine sample separately. But in men, the upper urinary tracts are usually not affected because there is a long urethral canal. The prostate gland, secretion, juice, and all this comes out from the side of the prostate gland externally, and therefore an infection from the outside, inside, to the bladder is extremely rare. If your doctor tells you that you have cystitis, men practically never have cystitis, just as they never have pyelonephritis. Men, on the other hand, have prostatitis, cystitis, and pyelonephritis are female diseases. Remember this: if your urologist diagnoses you with cystitis, I would immediately question the competence of this doctor. Frequent bathroom visits and similar symptoms are common with prostatitis, not cystitis. Avoid inserting enemas into your urinary tract. Dear friends, thank you for watching this episode to the end. Subscribe to my channel about man's health and longevity and follow the new episodes that come out almost every week.